Why did I choose to get my love handles and lower back skin reduced and fat cells cut out? Here's the thing with fat cells. This is very, very important to understand. Critical.
This is
important. I made a
important.
huge mistake. And love handles on a bodybuilding stage are a non-starter.
I guess I'll never be in bodybuilding. What's up, everybody? I'm Dr. Jeremy Bosworth. I'm a plastic surgeon and a fellowship-trained aesthetic surgeon at North Texas Plastic Surgery. If you know me at all, you know that I love sports, I love fitness, I love being healthy and active and working out. And that's also a community that I love to work on at work and deal with at work. And it's something that I am passionate about. It's a community that works hard in the gym, knows how to diet, and you might not think that they're a common plastic surgery candidate, but there's not a specific type of person that's a plastic surgery candidate. There's people who have little areas or bigger areas that are just stubborn areas that they can't get rid of in the gym or with diet, and there's reasons behind that, and we'll get into that a little bit in this video here. But I found this video, a guy named Dr. Mike. He's a big time fitness influencer right now. He's an exercise scientist who is a bodybuilder. He does coaching, and now he's a big time fitness influencer. And he put out a video that I found fascinating. He, big time fitness influencer on the internet, had plastic surgery, and he put out a whole video talking about that. And I wanted to watch this video with you guys and comment on it and kind of just go through what he talks about, his experience, and I'll put my own commentary into it. And I think this is really interesting, and I think this is really big because, again, most of the people I've worked on, athletes, I've worked on fitness people, usually they're the kind of people who don't want other people to know that they've had this work done. So the fact that this big time fitness influencer is out there putting this out on the internet, on his page, I think is awesome. And I think this is a big step forward because it doesn't have to be a secret. It's not that these are shortcuts that we're trying to do here. And he's going to get into that in this video. This is working on little stubborn areas or big stubborn areas or just areas that don't go away with any amount of diet, with any amount of exercise. And there's things we can do to help, and that doesn't mean that it's a shortcut or cheating. So let's get into this video here, okay? We're gonna start watching it.
Hey folks, I just had plastic surgery. Wait, what? It's true, I really just did.
So as you can see, even he knows people are going to be shocked by this. This, again, fitness influencer all over the internet, plastic surgery. Not something you would think would be out there.
I had a procedure that I will get to in a second, more detail, but to take some extra loose skin and fat cells away from my lower back and love handle area. That's why I'm sitting here right now, and I will show you the drains, but it's kind of disgusting. So
he's going to get into it more, but that's a common thing we do. The love handle area, super common area to have stubborn skin, a little bit of extra fat that just doesn't go away in the gym. It's one of the most common areas we work on, and he's going to talk about his experience with it.
Get to the surgery details in a little bit because I want to be super transparent and open with you guys. That's what we do at RP. And I'm going to kind of talk you through the whole journey, including sort of what led me to this and how this went, what this might kind of portend for me in the future, and also talk a little bit about, was this worth it for me? And importantly, could this kind of thing be worth it for you, the viewer?
Again, super important. I mean, he's going to talk about his experience. I've listened to this video before. He's super brutally honest about it. Just like I try to be with my patients, I try to prepare everybody for what this experience is going to be like. So not only is this about the fitness community and that even you can be a candidate for this, but just in general about what the surgery experience is like, whether you're a fitness person, an athlete, or it's just a mommy makeover, or just, a little bit of something that you want changed.
And the listener watching and listening along, and also talk a little bit towards the end about kind of what is the morality of getting cosmetic surgery, especially when you're a fitness influencer like me and you're supposed to be able to help people's bodies through like apps and stuff that you sell and make money from. All of a sudden you're back behind a dumpster having someone put a chainsaw to your nutsack. How does that comport? I guarantee you it does, and it's fun.
There's no chainsaws used here.
Fun. You should try it right now. Backstory. Why the hell did I have to get, because I didn't have to get it, why did I choose to get my love handles and lower back skin reduced and fat cells cut out? Couldn't I have just done it through diet and exercise? Well, here's the thing. When I was drug-free for the first 12 years of my lifting career, up until I was about 27 years old, I was reasonably lean-ish through high school.
Drug-free, I think he's talking about steroids there. I don't know what other kind of extracurriculars he's doing, but I think in this situation, he's referring to not using steroids at that point.
But then in college, I started competing in powerlifting. Everyone knows where this is going at this point. And I was like, you know what? The heavier I get, the stronger I get. And I love being strong. I didn't really have body image stuff. I just didn't care, which was kind of cool psychologically. But I was like, I don't care if I have a gut or I have love handles, I have a puffy face. Who gives a shit? I just want to be strong. And I just kept gaining weight. Now, I would do cutting phases and gain and cut and gain, but I kind of would like assume I was gaining 10 pounds of muscle every phase. And I was cutting, purely, 10 pounds of fat every time. And that's absolutely, it was not the case. By the time I was about age 27,
So this guy's an exercise scientist. He's going to get into a lot of the physiology of this, and you can listen to that, and it's good information. I'm not going to get into all of the physiology of that, but he does bring up some important points about how things that you do throughout your life can really affect you in the long term. It can affect the tissue that you have and how it's going to hold up to aging over time.
I was a drug-free 270 pounds at 5'6", and you almost certainly right now see a picture of me from behind in that sort of situation. And gee whiz, that's a different look. If you guys see from this picture, my love handles are egregiously sized. Being 270 pounds at 5'6".
Again, that love handle area, super common area to have as a stubborn area. I've seen marathon runners come to me with big old love handles in that area just because it's an area that just doesn't go away. But man, did you see that guy's back? That is a lot of muscle that he's got there. That is crazy.
And having love handles to stretch out to there, whereas my hip bones are like 1/2 of the way in, that is a ton of extra fat cells put on, a ton of extra skin gained. And here's the thing with fat cells. This is very, very important to understand. Critical.
This is
important. I made a huge mistake. That's why I had to have the surgeries to reverse the mistake. This wasn't just for pure enhancement. Those surgeries would be in like mid-2030s when I get in robot arms or some shit. So what was the mistake that I made? The mistake was to not know physiology. What part of physiology did I not know? You have a certain amount of fat cells that by the time that you're a teenager, you have kind of a certain number. And if you gain, in general, up to about 10 to 15 pounds of extra fat, those fat cells just get bigger. And then you lose it and they get smaller. And you gain it back and they get bigger.
That's what I talk about most of my patients with and why the surgeries that we do make a difference. And, he's going to get into a little bit more about how the fat cells can grow in number. But most of the time when you're gaining and losing weight, it's really just about the same number of fat cells getting bigger and smaller. Now, in the extreme situations, there's a little bit of different situation, and that can really affect you long term. But I'll let him get into that a little bit.
So 10 to 15 pounds of even pure fat gain, which means something like 15 pounds, maybe to 20 pounds, pushing it, of total tissue gain during a massing phase. Probably more like 15 pounds of total tissue gain during a massing phase, plus or minus 15 pounds, does nothing to your fat cells except fill them up and then reduce them, fill them up and then reduce them. However, if you go much more than that on a single gain phase, at some point, your fat cells get so big that the nucleus inside of them, the control center of the cell, at some point when the cell gets big enough, it can't control its own exterior, and then it would start to malfunction. And evolution is a very, very well thought out way of how to deal with that because it's been dealing with eukaryotic cells for like billions of years. At some point, your fat cells recognize that their cellular domain is too big and their nuclear domain, the amount of volume the nucleus inside can control. And they go, okay, well, we're still gaining. They go through mitosis, which means they split and the nucleus splits, the cell splits, and now you have two moderately sized fat cells the equivalent volume of the huge fat cell they just came from, but now there's 2 of them.
So he's talking about this from his massing phase, what he calls it. That's kind of the bulking phase in the bodybuilding world. But it's not just about in that. I deal with patients not only in the athletes, fitness community, but also people who have lost or gained a ton of weight. And that's a very common person who comes to me who's once was very heavy, now has lost weight, and they've got these similar changes that have happened throughout their life. And so this doesn't just apply to the bodybuilder who's really trying to bulk up. This is life. So this is really good stuff and really important stuff. And I'm glad he's talking about it.
And then as you gain weight, those cells get big, big, big. And then if you gain much more weight, another 15 or 20 pounds, they split in half. And now you have 4 moderately sized cells, and so on and so forth. Here's the real kicker. If you get such big cells that they split into 2 cells and then they get bigger, let's say they never split again, they get bigger. You used to have 1 fat cell, now you have 2 fat cells for every 1 fat cell you have. When those new fat cells get bigger, you're like feeling real full, eating is really tough, whatever. Let's say you come back down and you go all the way back down 30 pounds in body weight, not even 15, to where your new 2 fat cells are teeny tiny. Here's the problem. 2 nuclei, 2 fat cells worth of hormonal screaming into the bloodstream is double the eat more food hunger drive. It's double the spend less energy and have less physical activity energy for your cardio towards the end of your diet. It is double diet fatigue, double the probability that you're going to rebound back to being big. Once the cells split, they want to be full. Fat cells want to be full of fat.
Again, this is pretty in-depth physiology of fat, but these are important things. Fat cells and different cells throughout your body trigger you to feel hungry and things like that. And these are different things that weight loss medications and different things can target. But without getting into too much detail about that, it matters, whether you've lost all the weight or not. These things really matter. Let's keep listening.
Gigantic and almost bursting, but nice and moderately sized. So because I had gained so much unchecked body weight, I had so much cellular multiplication that, especially just because of my genetics, a huge fraction of my body fat was stored in my love handles and in my lower back. The number of fat cells in my love handles and lower back had accreted to such a huge size by the time I was 270 that by the time I got back down to being super lean and being DEXA confirmed, 6% body fat and all that stuff, I still had 2 things. An enormous number of fat cells in there, which actually, if I have too much hydration, they fill up with fluid and then it looks just like a fat love handle, except if you wiggle it, it's not as dense, it's just shaky. But from a visual perspective, it looks just like it's full of fat. And also the skin has the same idea as once you stretch the skin cells multiply and they don't really resorb back. So excess fat cells, making everything more difficult about losing weight and managing everything. And then excess skin cells meant that once I lost through diet and exercise and copious uses of drugs, once I lost all of that body fat and got down to a body fat I had never been into my entire life in my late 30s and early 40s, I am in my early 40s, late 30s, I still couldn't get rid of that extra skin. And I had all those extra fat cells, which I did to myself.
Oh, that's the key right there. The extra skin is huge. He's talking about the fat cells, also super important. There's things we can do to target that, like what he had done. But the skin is the biggest problem that we see, that I see commonly, whether it's because of what he does and, bulking and then losing and cutting and bulking and cutting, or people who are just very large and have lost a ton of weight. The skin, that's the basis for most of the surgeries that I do. Whether it's in females in the breasts or the tummy, because the skin just stretches out. And not only, he was talking about skin cells multiplying, but when it stretches, it loses some of its strength and its elasticity. So when you get things like stretch marks, that's a scar under the skin that basically is skin losing its elasticity or its ability to rebound back. So even though you've lost the weight and the fat, you're just deflated skin, and you've traded one problem for another problem. Now the fat's gone, but you still don't want to go to the pool without a shirt on. You don't feel comfortable in the gym or wearing different clothes because the skin is the biggest problem. And that's why we do, excisional procedures like the tummy tuck, like a breast lift or a breast reduction. We can do surgery on the arms to remove skin. Pretty much anywhere there's extra skin, we can get rid of it. But that's really where, even if you're able to lose the weight, it's that skin that there's just no amount of diet and exercise that's going to make that skin get better.
And so for me, there were two problems. One, when I was getting ready to do bodybuilding shows, a lot of my fluid management and peaking processes had to be heavily modified and more complex, because at the same time they needed to be full with muscle and nice and veiny. I couldn't be too full because then my love handles will fill up with water. And love handles on a bodybuilding stage are a non-starter. Doesn't matter what you look like. Yeah, love handles. The judges even see them a little bit poking out of your posing suit. You're done. Like, that's it. That ain't it. You could do very poorly at a bodybuilding show just because you have
I guess I'll never be in bodybuilding.
A very even, smooth, thin layer of fat, but at least you're muscle shaped all over. You're not like nothing's spilling out. But if you have anything spilling out, I mean, it's lights out, right? It's lights out. That's problem number one. The big problem I ran into lately, which I just was done with doing, was every time I would come back to off-season body fats, which could be as low as 8%. I have pictures of me at 8% body fat with distinct voluminous spillover love handles, but my quad
Spillover love handles might be a little exaggeration in that picture. I think he looks pretty lean, but he's got areas that bother him, and I get it. And he's got a specific look that he wants. And that's what plastic surgery is about. It's not about what other people think of you, because lots of people might look at this guy and be like, what the heck? Why would this guy get plastic surgery? But when he looks in the mirror, this is what he sees. This is what bothers him. And he's an expert. He knows what caused this and why it's happening. And he knows that there's just not a lot that any amount of gym, diet, exercise is going to do. Because look at the guy. I mean, he's jacked. He's super lean there, but there's still extra skin, and there's still extra fat in areas that he doesn't like.
I want to look like someone who can pull off their shirt and they're like, whoa, like that person is lean and jacked, not shredded, but lean and jacked. But if you have love handles that spill over because I've been so big before and the excess skin and fat cells are there, it's just not the look. It's not the look. So what I'd like to look like in my own personal life currently, eventually, I think years down the road, I have like a really stretchy abdomen. So I have a really big gut. You guys have seen, I'm sure, some of the videos on Instagram that really super went viral where I can like relax my gut and it's this big beer belly. And then I tighten it up and it's this huge vacuum. Like there's clearly no fat in there anymore. And I have DEXAs to say there's, 0.1 kilos of intra-abdominal fat. It's just like big gut. My dad has a big gut. My mom has a big gut. Like everyone in the family just has loose abdominal thing. Eventually, I want to get that tightened up to have a really tiny waist.
He's talking about a tummy tuck there. Eventually, some of the tissue of the tummy can be a little bit loose, and oh my gosh, such a bad problem to have. He's so strong with such little amount of fat, but if you have some tissue laxity there, similar to what happens during pregnancy when the baby's in there growing and it stretches the tissues, and then the baby's gone, so you've lost the volume, but now that tissue is just kind of lax and it gives you that kind of round protuberant looking belly there.
I don't mind the power belly look as long as it's shredded and veiny. The love handle look, I cannot tolerate anymore. I never liked it, but now I really don't like it. And so what I'd like to look like is, 40-year-old jacked bodybuilder dad look. Got the little round belly with abs on it. That's cool. I got that. But no love handles. A little teeny waist from behind. I just wanted it. So that's why I said after I was done competing for the whole YouTube reason last summer, I was like, okay, let me look into surgeons. Let me find what works. Finally found a surgeon. And I'm like, okay, I'm doing this. And
now there's some important things to go over, because just because somebody sees something on their body doesn't mean they're a candidate for surgery. And that's part of my job, is to kind of make the distinction about what's realistic and what's not realistic. Like I said, some people would look at this guy, and I don't necessarily disagree that he's jacked, he's lean, and doesn't need plastic surgery, but he's got a real problem. I mean, you could see the pictures that he had. He's got those love handles, a common area. Now, if this guy were to come to me without the love handles, had maybe a tiny bit of extra fat and wanted some big surgery, I would have to have a real heart-to-heart talk with this guy and talk to him about what's realistic, what's not, what's worth it, what's not, and can this even help you? I don't want to make a cut across somebody just to say we did surgery if it's not going to accomplish their goals. But in someone like him who had a real problem, who it's clearly psychologically bothering him, and it's real, it's there, it's physically there. That's somebody that probably is a candidate for surgery.
There are trade-offs to this. Surgery is taking me out of training. I'm 1 week into not training, and I have 5 to 7 weeks more to go.
And this is where he kind of gets into the recovery after surgery, an important part of the process of surgery and deciding if it's worth it for you, and something that I go into detail with every one of my patients during consultation about what to expect after surgery. What can you do? What can't you do? How long are you going to hate me for after surgery because of the pain? I get into all that, and I don't want to sugarcoat it. I'm not trying to sell you a surgery just to sell surgery and then have some totally different experience after surgery. That would be not good, and no one would ever come back to me. But these are some important points he's about to make here.
Depending on how things shake out, of no weight training at all, fellas. That's a trade-off. Now, here's the good news. If you don't lift for 2 months, you regain every single gram of muscle after about a month of lifting again. Worst case, 6 weeks. Not a problem. Also, your joints heal like you would not believe. But man, nobody likes to get, I'm gonna watch my body, like my muscles gonna like flush off my body. It's gonna be gnarly. Lifting is super fun. It's psychologically super invigorating. I love doing it. I won't be able to do Brazilian Jiu-Jitsu, which I do all the time, for 3 months. There are infection risks with surgery. As I speak to you right now,
there's different reasons for why we have these rules, and every plastic surgeon is going to have a different time frame for when you can and can't do stuff. For me, it's usually about 3 weeks before I want you doing any cardio or even really getting your heart rate elevated at all. 6 weeks before I want you doing any lifting and straining. And then depending on how the recovery is going, it can be even longer for a number of things.
Now, some of these pictures will confirm that. I have 2 drains, 2 plastic tubes coming out of my lower back. They're inside of me.
Yeah, the tubes are kind of a necessary evil. It's, we put drains in areas that we put a lot of dead space, or where we use a lot of fluid to do liposuction. And the body can handle a certain amount of fluid in order, that whether it's inflammatory fluid or fluid that I put in, it can reabsorb a certain amount. But typically after a big surgery like this, it's going to be way more fluid than the body's able to handle, especially in those early 1 to 2 weeks. So that's why we leave the drains in there, and they can be a little bit messy, as he's gonna show you here. But they're a necessary evil, because without the drains, fluid gets trapped in there. Then we got to go put needles in you to try and drain this fluid out, which sometimes happens anyways. But we try and minimize the chances of things happening or needing additional procedures.
And I'm wearing, no joke, adult diapers right now so that I can bleed into them as I sleep and walk around.
Now he's saying bleed into them. He's probably being a little bit dramatic. The fluid that comes into the drains is bloody looking. It's mostly inflammatory fluid and fluid that we've put in during the liposuction part of things, mixed with a little bit of blood. It looks bloody. He's not actively bleeding out. He's draining this fluid that looks a little bit bloody. But mad props to him for putting a picture of himself wearing adult diapers with his drains out there, because that's pretty ballsy.
For surgery and scars, of course. But why I did it was because all of that stuff is worth it to me, to finally be able to be like an actual person who looks like they do fitness.
And that's the important thing right there. It was worth it to him. He's been through it now. He did his research. All these things, the recovery, like he said, the scars. This is a trade-off for scars. A lot of plastic surgery is, big scars. Now we try and hide them, put them in an area that's pretty easy to conceal, make them heal as well as possible. but a scar is a scar. Once a scar is there will always be a scar, and everybody heals a little bit differently. So it's got to be worth it to you. And if it's something that bothers you enough, like it did to him, it's probably worth it.
Now let's talk about the process. So I had a surgery consult, got the surgery booked, and so get there, and here's a funny story. We get to the pre-op room, and they get all the tubes put in and everything, and they walk me over to the operating room, and I'm in like a robe, and they're like, hey, like you have to take your robe off, and we have to scrub you down to make you completely what's that called, antiseptic. And there's like one dude and two ladies in the room prepping everything. These are like people my age, and I'm like, you guys just want me with out? And they're like, yeah, we don't give a shit. We see this all the time. And I was like, yeah. And then so I just like, it's a weird experience standing completely naked, having someone rub you down with the Hibiclens stuff in front of.
So it sounds like you had what's called a standing prep, standing awake prep, where you prep the whole body 360 degrees all at one time. Then they lay you down on a sterile table, put you to sleep. Everybody's got their own techniques. I don't do the standing prep. If I'm going to work on both sides, I'll usually prep one side once you're asleep, so you don't have to stand there completely naked, and then we will flip you over, prep you again. There's different ways to do it. There's not a right or wrong way, but it's kind of a funny story.
A really trippy experience. They laid me down on the table. The anesthesiologist came in, made a few jokes, and I don't remember shit after that. Wake up, I'm in an abdominal binder, which is a huge lifting belt thing with pads in it. And because they had me laying like this during the surgery and my shoulder mobility sucks, the first thing I remember waking up was like, oh, my shoulders. And then my throat is super sore. They have the plastic intubation tube so that the machine can breathe for you in case you croak during surgery.
It's not really in there in case you croak during surgery. I mean, I guess technically it would come in handy if that happens. It's more used because your body is essentially paralyzed during surgery. Your muscles of respiration aren't really working if they're using paralytic. And we just want to make sure that we're able to oxygenate. But it is one of the most common things. We like to blame anesthesia, say that everything that you're feeling is because of them. The sore throat after surgery is because of the tube from anesthesia. So that's what he's talking about there. Freaking anesthesia.
Right after the surgery, they give you like an hour or two to kind of get yourself together. And then they're sort of like, get the fuck out of here. They put me in an Uber. God bless that man. We tipped him very well. I bled into his car. Apparently you just bleed from your ass all the time. Why am I bleeding? Because
I'm sure the story is totally true. First off, sounds like you had a pretty big surgery. When I do this kind of thing, I'll usually keep somebody overnight if it's that big of a surgery or they're going to have that much of a mess. Second off, I would never let somebody go home in an Uber after surgery. God bless that Uber driver who was dealing with this guy who was recovering from anesthesia and apparently bleeding all over the place. But whether it makes for a good story or it really happened, it's all about safety. Have a responsible driver, whoever that's going to be, take you home from surgery.
Because they put the drains in a literal hole in my lower back. They closed all the other incisions, wasn't bleeding through my incisions, but the drains will take all the blood out and put them into the JP collector bins. But that isn't quite the full story because those holes have to close up a lot first for only the drains to collect your fluid. And before they close up, there's just a giant hole, and like most of the blood and serous fluid, which is the fluid inside between all your organs of your body, that just comes out, man.
That's all true. It's not just pure blood. It's mostly inflammatory fluid that we've put in mixed with some blood. So it looks like bloody fluid to the, average person. They probably think it's blood, but it's not. It's just a bunch of other fluid mixed with blood. And it's true. It's pretty messy. Some of those pictures look nasty. Probably not as much fluid as it looks because, when you put a little fluid on a sheet, it tends to spread and look a lot worse than it is. But I always tell my patients first 2 or 3 days are going to be pretty messy. And after that, it will pretty much start to dry up and only collect in the tubes.
Just 3 days later, we had the first initial post-operative look-see with the doctor, post-operative appointment, and then we could drive back to the Detroit area in which Crystal, my wife, and I live. And so those 2 days in the Doubletree Hotel in Chicago, Illinois, were like hell, I guess, like a blur. I wasn't on Percocets most of the time, just every now and again when I couldn't stand being alive anymore. Tylenol actually did a really great job of pain control, believe it or not. And the itching in the binder was crazy. The pain was pretty crazy. They tell you basically can only move in like 2 directions because you can't round your back anymore because it'll pull the stitches out or whatever. And so I had to like remain in a weird position. I bled all over the bed, and I ended up sleeping in a puddle of my blood and serous fluid every night.
Get some puppy pads. Don't worry. Don't use your expensive sheets, and don't wear your fancy underwear for the first few days. After that, things will dry up a little bit, and you can start to work those things back in.
Before you assume that surgery is a shortcut or the easy way out because dieting is too hard, walk that back. Because if you think, hey, I'll just get the surgery and it'll be easy, I'll just get rid of all this fat, you will get rid of all the fat, but it will not be easy. I'll say just the first 3 days post-surgery alone, the area under the curve of pain and discomfort is easily the size of 4 or 5 12-week-long, very hardcore fat loss phases.
So I don't know how hard for hardcore fat loss phases is, but again, I always tell my patients, first week, you are going to hate me. Now, what surgery he had, I'm not sure exactly. It sounds like he had some excisional skin surgery around his waist, as well as probably some liposuction, depending on how far around they took the incision. I don't know. I didn't see any full 360 views of this. But there's definitely from the back and to the side. So he had a lot of skin removed. I don't think he had a tummy tuck, meaning tightening of the muscles, because he mentioned earlier that he hopes to potentially have that in the future someday. That tends to be really painful as well. So Dr. Mike, if you're going to have that surgery, be prepared. That muscle tightening down the middle of that diastasis is going to kick your butt.
In a fat loss phase and a fat loss diet, it's tough, but you're just in it. There is no, you're just in it for the shit, fellas. You're like, get me the fuck out. Like, I meditate. I'm like on mindfulness meditation. It took me a lot of presence to be like, I am in a place of discomfort where nothing I tell myself in my head is going to make me feel better. Somehow I have to architect that into being, I'm okay with it. Now, for what? Because a lot of people on social media are like, dude, you don't have any lower back fat and you don't have love handles. You're delusional. I wish I was. So we have some pictures for you. The before, then when I was super fat, 270, roughly 235 pounds, I was pretty lean, but you can see the hanging skin. And then this picture that you're going to see here is going to be taken 4 days post-surgery when we took the binders off for the first time. You can see my waist from behind looks nothing like it's ever looked in my entire life.
Well, that's pretty insane. I mean, I love results like that. A lot of the mommy makeovers that I do, these are the kind of results that we go for and that I love to get. Just really dramatic results. And it's not that, we don't change the bony structure or any of the underlying muscles or anything. Now you can. There's some surgeries that are being done now where you can change some of the bony structure and rib remodeling and things like that. However, in him and in the majority of the surgeries that I do, it's just removing that stubborn skin and stubborn fat to really bring out that underlying structure and, in him, get him the look that he wanted. And that's really a dramatic change. That's impressive and really cool for him.
Tell you what, like before I saw that, I was like, I don't know why the hell I did this to myself. I made a huge mistake. I didn't really think I made a mistake, but I was like, I don't know about all this. The first time my wife showed me the video of she recorded of me looking at my waist. I can't see my own waist. I can't even turn my head to look in the mirror enough at this point. I was like, oh my God. By the way, that's the worst my waist is probably going to look for the next year because the acute swelling is really high. Within about 3 or 4 weeks, the acute swelling comes down. And then there's long-term swelling that legitimately takes up to 1 year or more to come down.
I love that he's going into all this because this is all true. He's right. It's only going to get better from here. And that's what I always tell my patients. I see him at the 1 week, some pretty dramatic results, but it only gets better. Not only as the swelling goes down, But, I'm sure in his case and in a lot of my patients' cases, the more you stay in shape, stay healthy, stay active, that's only going to enhance the results. But really that, the first 3 months, 6 months, as that swelling goes down, it continues to get better and better and better. And it's really exciting to see. But it's also important to have those before pictures like he does, because sometimes patients will come to me and say like, I don't know how much of a change I got. Well, look, then we'll show the before and afters, and then they can really see the dramatic changes like he just did there. And it's really cool to see that.
So another thing for folks looking into surgery, is this some shit you do 8 weeks before you go on a cruise? It's a year to a year and a half before you really want to make an impact on your physique somehow.
You probably don't want to book a cruise 8 weeks after your surgery. It doesn't have to be a year to a year and a half before you're feeling good about your body, though. I mean, really, the first 3 months, you've seen some pretty dramatic changes. You're feeling a whole lot better. You're feeling back to normal. You're looking pretty much normal. Is there still some swelling there? Yes, that swelling can take 6 months, even up to a year to fully go away. But at the 6-week mark, you're going to be feeling pretty much back to normal, still some swelling. 3 months, you're going to be feeling and looking pretty normal. So just depending on what kind of plans you have, talk to your surgeon and figure out when's the best time to do it. But it doesn't have to be a year and a half, but it can take that long before you do see the final results.
And the later results are probably going to get even better. Not easy at all. Holy crap. Worth it to me for sure, because I have some hangups about my love handles. I just don't want them around anymore. Is it worth it to you? That is only a decision you can make for yourself. Watch as many YouTube videos about people's procedures as you can. Look up a lot of before and after pictures. Potentially talk to folks that have gotten the surgery themselves. There's tons of these people on social media, by the way. They love to talk about it. It's great. Look at both the upsides and the downsides, and how long the recovery time takes, and the risks, and the financial costs, because this shit costs like thousands and thousands, tens of thousands of dollars. If it's worth it to you on a calm, sobering analysis, it'll probably be one of the best decisions you've ever made. If it's anything less than worth it to you, you might as well just like get beat the shit out of and bit up by a grizzly bear, because you'll get the same amount of recovery and cool pictures of yourself bleeding half to death, but at least you have a cool story.
It's such a personal decision about, is it worth it to you? The financial part, the pre-op, prep that you need to do that would make sure you're healthy, the post-op recovery, going through the surgery, and the risks of surgery. It's all got to be worth it to you. And that's why it's important to talk to your surgeon about this stuff so that you know what you're getting into. Don't just listen to some sales pitch about surgery. Although you're coming to us to help you, but I don't just want to sell you surgery. This can be life and death. I mean, this is going to cause scars on the body. It's got to be worth it to you. And with my patients, I find very few of my patients who ever even think about regretting the surgery, because I do such a thorough job at preparing them for what to expect. I think it's the people that regret surgery are the ones that rush into this or do it for the wrong reasons. And then they realize that it's not just some easy shortcut. It's not. This is hard. This is a lot. And being prepared for this and watching videos like this, talking to your doctor, looking things up on the internet. Be careful with the internet, though. There's a lot of false information out there. But that's important. And that's how you're not going to regret your surgery and be willing to take these risks.
Now, one last thing is, there have been a few questions on my social media, on my Instagram, because I posted all these pictures kind of the day after. It was a bit more of an accusation of like being a fitness influencer who, has RP Hypertrophy app, RP Diet Coach app, a team of coaches. Ostensibly, you're supposed to be helping people reach their best. How can you possibly be such a hypocrite and do plastic surgery? That is a very good question. That is a very good question, because it looks like hypocrisy. It looks like hypocrisy, but isn't. I'm a hypocrite on many, many things. This is not one of them, and I'll tell you why. I am for using every single kind of technology, including diet, training, drugs, already use those, surgery, and even in the future, genetic engineering and cyber enhancement, to get to whatever you want your body to look and feel and be shaped like and be capable of, because it's your body. I believe that you own your body. You should be able to do anything you want with it as long as you're an informed adult and it doesn't hurt anyone else around you in a literal physical way.
I don't totally disagree with that. I mean, I mostly agree with it. I think the informed part is what's a little bit challenging there, and it's hard to know what information is good and not good out there. So someone like him, you know, scientist knows but what good research is, you know, but it's hard to kind of weed through the good information and the bad information out there. So it's hard to know what's good and what's not and truly be informed. So, you know, taking it to the extremes, you really got to make sure that you're really well informed with good information.
So to me, there is no moral distinction between cleaning up your diet, doing some cardio, doing some training, and doing some drugs on top of that, as long as you're not cheating in a federation in which it's, you know, like competing in a drug-free bodybuilding or something like that. And surgery goes right in there along with that. And to me, this is a big part of what I call the aesthetic revolution that probably started in a big way with the arrival of Ozempic and tirzepatide. An ability for humans who now more and more people in the world are richer and richer. Medicine is getting more advanced through AI, that more and more people are going to want to look internally to their psychology and to their physiology and anatomy and go, how can I make myself better? Because nobody wants to be ugly and nobody wants to be over fat or too skinny or misshapen or any of that. So I'm 1000% in support of any body modification procedures that humans want to do, full stop, and including on myself. Does that mean I've traded away my authority on an exercise level and a diet level as an influencer or whatever? If you think so, I totally respect that opinion. I don't think it's true because you guys follow me for what I'm saying, not for how I look. Look, we've all seen pictures of my body. You're not trying to look like this. Never were. Pre or post surgery. Do I think people should do surgery? No. Do I think people who want to do surgery should do it and it makes sense for them trade-off wise? 100%, yeah. Anyway, guys, I hope you learned something and enjoy the gnarly pictures if YouTube doesn't take them down. And yeah, surgery's a big deal. Worth it to me, maybe worth it to you, maybe not. Make your own decisions. See you guys in the comments.
So fascinating stuff here. I love this video. I love that he put this out there. I think it was a very honest take on what he went through, why he did it, what he experienced, and if it was worth it to him. And I think that's big, and we need more of that out there, especially in this community. You know, I'm happy to continue to answer questions. If anybody has any questions, you know, put them in the comments of this video, and I'm happy to answer anything. We'll put a link to the full video that he did about this down below as well, so you can check that video out as well. Check out my other YouTube videos. I've done some other kind of fitness and sports-based videos, and you can check those out on our YouTube channel as well. You can check me out on my other social media platforms at Real Dr. Boz. I'm on Instagram, on Facebook. We've got our website. You can Google search us, North Texas Plastic Surgery. And if you are interested in surgery, I'd love to hear from you. If you have questions about surgery, just let me know. We can get you set up for a consultation and go over any questions that you have. If you like this video, make sure to like, comment, and subscribe. Let me know if there's any questions, and thanks for listening.